This was an in vitro cell study, and we had this hypothesis that because hypoxia is a very demanding condition for the cells, and they need to adjust for hypoxia, but nevertheless hypoxia is very common in prostate cancer microenvironment. So we wanted to see whether lipid metabolism is part of the adaptation mechanisms that the prostate cancer cells use when they adapt to hypoxia. So we had this series of prostate cancer cell lines that were created from a commercial VCAP prostate cancer cell line. So first of all, we had this VCAP that is androgen dependent, and then we have VCAP that is androgen independent. And the third one is the VCAP cell line that is resistant to enzalutamide. So these cell lines, they are like a model of different stages of prostate cancer treatment. And we see that these most resistant cell lines, enzalutamide resistant cell lines, they tolerate hypoxia much better than androgen dependent cell lines. And this is kind of expected because hypoxia has been previously linked with treatment resistance. But what's novel in our study is that we observe that this hypoxia resistance associates with increased accumulation of lipids in these enzalutamide resistant cells. And that is like a success that this lipid metabolism is indeed important for the cells to overcome hypoxia. And we also did a more detailed analysis of a lipidomic profile in these cells using mass spectrometry. And indeed, lipidomic profile is quite different in enzalutamide resistant cells compared to androgen dependent cells. And when they are exposed to hypoxia, in androgen dependent cells, the lipidomic profile changes quite profoundly, but not so in enzalutamide resistant cells. So all in all, this study supports the idea that lipid metabolism is very important survival mechanism for enzalutamide resistant cells and may help them survive in hypoxic microenvironments.